Thank you so much for the time that given to us to present the pathophysiology and nursing care for children with epilepsy. So here's are the member of Group C. So this is the agenda for our presentation today.
Okay, so we're going to start with the definition and types of epilepsy. Epilepsy is a chronic non-communicable disease of the brain that characterized by recurrent seizures, which are brief episodes of involuntary movement that may involve a part of the body or the entire body and are sometimes accompanied by loss of consciousness and control of bowel and bladder function. So epilepsy in children and adults are slightly different based on the types, the causes, and also what triggers the epilepsy to happen. The picture you see in the PPT is a child with an electroencephalogram or EEG, which is a procedure where we placing electrodes in the children's scalp to record the electrical brain activity. Okay, we're moving to the types of epilepsy. There's a lot of types of epilepsy, but I will explain the most common in children. First is absence epilepsy. Brief spells during which the child loses awareness for a few seconds and they become pale, stare into space, and don't respond if you talk to them. Your eyes may also twitch and your eyes or head may roll back. These brief absences can occur up to 100 times a day. And then the second one is romantic epilepsy. It is a one side of the face twitches and sometimes one arm or one leg twitches too. The child may also experience tingling, numbness, or problems with speech and swallowing, and also start to salivating more or drooling. They are usually aware of this happening. This kind of seizure typically happens while falling asleep or waking up. And the third one is juvenile myoclonic epilepsy, which is this type of epilepsy that first arises in puberty. The seizures involve muscle twitching and jerking movements of the arms and shoulders. They usually happen in the morning after waking up. The knees sometimes give away too. And then the fourth one is infantile spasms, or we usually call it West syndrome. This is a severe type of epilepsy, nearly always starts in babies. During seizures, the child's whole body bends and stretches, and the muscles in their neck and torso convulse or jerk and twitch. The seizures usually occur shortly after waking up or while falling asleep. They often only last a few seconds, but can occur up to 100 times in a row, which breaks between them.
2. Causes of epilepsy. Epilepsy is caused by a dysrhythm electrical disturbance in nerve cells in one part of the brain that causes these cells to discharge abnormal, repetitive, and uncontrolled electrical charges. Other factors that cause epilepsy are 1. Idiopathic. Most epilepsy in children is idiopathic epilepsy. 2. Hereditary factors. 3. Genetic factors, infebrile seizures, and breath holding spells. 4. Congenital abnormalities of the brain, atrophy, porencephaly, agnosis of the corpus callosum. 5. Metabolic disorders. 6. Infection, bacterial or viral inflammation of the brain and its membranes, toxoplasmosis. 7. Trauma, cerebral contusion, subarachnoid hematoma, subdural hematoma. 8. Neoplasm of the brain and its membranes. 9. Vascular abnormalities, malformations, collagen disease. 10. Poisoning, fever, head injuries, and post-head injuries. 11. Oxygen deprivation or neonatal apsia, especially during the birth process. 12. Hydrocephalus or enlargement of head size, impaired brain development. 13. History of infant and mother using anticonvulsant drugs that were used throughout pregnancy. History of high-risk mothers, labor force, women with difficult childbirth background, drug users, and diabetes or hypertension.
Sign and symptoms. So first, the sign of symptoms is increased body temperature. The second, anxious. The third, breathing problems. The fourth, hypoventilation. The fifth, apnea. The sixth, mucus hypersecretion. The seventh, motoric seizure. The eighth, loss of energy. The ninth, pale skin color. And the last is seizure.
So, the following are some of the complications that can occur due to epilepsy. The first is physical injuries. Uncontrolled seizure, especially those that occur suddenly, can cause a person to lose consciousness or muscle control. This can lead to falls and injuries during an epileptic attack. The second is epilepticus status. This is a condition where seizure lasts more than 5 minutes continuously or occur repeatedly without recovery in between episodes. This condition can cause permanent brain damage due to lack of oxygen in the brain tissue. The third is cardiac complications. Epilepsy affects the autonomic nervous system, which regulates vital functions such as heart rate and respiration. During a seizure, sudden changes in brain activity can lead to arrhythmias. The fourth is psychological complications. Epilepsy is closely linked to mental disorders.
Neurochemical changes in the brain due to epilepsy can affect emotions and behaviors, leading to conditions like depression and anxiety.
Next, move to pathophysiology of epilepsy. The pathophysiology of epilepsy involves several complex and interrelated mechanisms, including the first one is imbalance of excitation and inhibition. Epilepsy is often caused by an imbalance between excitation and inhibition in the brain. And then role of neurotransmitter. Neurotransmitters such as glutamate and GABA play an important role in the pathophysiology of epilepsy. For glutamate, activation of posynaptic metabotropic and ionotropic glutamate receptors are pro-convulsive, meaning they can trigger seizures. And for the GABA, it decreases levels of GABA in epileptic fluency reaches inhibition of GABA receptors, thus increasing the likelihood of seizures.
6. Supporting examination. First, EEG, electroencephalography examination. This test records the electrical activity of the brain and can identify epileptic activity occurring during seizures or under specific conditions. Second, brain imaging examination. High-resolution MRI, at least 1.5 Tesla, to help identify structural abnormalities such as tumors or injury remnants that may cause epilepsy. 3. Laboratory examination, conducted to check for metabolic disorders, infections, or genetic conditions that may contribute to epilepsy. A. Routine hematology, routine blood, SGOT, SGPT, urine, creatinine, electrolytes, albumin, current blood sugar. B. OAE, blood levels. And the last, other supporting examination, lumbar puncture. While lumbar puncture is not a direct diagnostic tool to epilepsy, it plays an essential role in evaluating potential underlying causes of seizures and ensuring appropriate management.
General management of epilepsy. Management of epilepsy, seizure prevention according to Sketcher 20 and 16 consists of 1. The importance of recognizing the sign and the onset of epilepsy. A. Prodromal pace. A pace that occurs minutes to hours or even days before an awakening. Prodromal symptoms occur up to 40% of people with epilepsy, with symptoms such as headache, irritability, insomnia, depression, and hyperactivity. B. The aura pace. The pace that occurs a few seconds or minutes before the awakening and marks the beginning of the attack. Symptoms include strange abdominal sensation, cold sweat, dream-like experience, and the sensation of a strong odor. C. The awakening pace, or ictus in the pace. Make sure the patient airways is good. Make sure the area around the server is free or of sharp object. Monitor the duration of the attack. Tilt the patient on one part of the body to facilitate breathing and prevent saliva from covering the airways, and never put anything in the patient's mouth during an attack, including not giving medication or food until the patient is fully conscious. D. Pace after awakening or post-ictal. Patients return to their original mental status. This pace is usually absent, short or may last several hours, even days. Usually the patient wakes up with a headache, fatigue, irritability, vomiting, confusion, and muscle pain. 2. Adherence in taking medication anti-epileptic drugs. Anti-epileptic drugs, or OAEs, can suppress seizures but have no effect on the underlying disease. The goal of OAI therapy is to ensure the best quality of life for people with epilepsy by maximizing seizure control and minimizing drug toxicity. 3. Restriction of physical activity. According to Saja-Tofik 20 and 16, that excessive physical activity will cause patients to experience fatigue and become a precipitating factor for the occurrence of epileptic seizures. Limiting physical activity aims to prevent accidents, especially head trauma, both directly and indirectly, because head trauma will trigger epileptic seizure.
For the nursing management, these are airway management and seizure management. The purpose for airway management is to preventing airway obstruction. As mentioned earlier, during a seizure, the patient is unable to control the muscle of the body, including the muscle around the mouth and throat. This can lead to the tongue falling back or the presence of fluids such as saliva or vomit that can obstruct the airway. Airway management is important to prevent this and keep the airway open. Then for the seizures management, the purpose is to preventing injuries. When patients have seizures, they are at risk of physical injury, such as falls, head impact, or other injuries due to uncontrolled movement. Therefore, seizures management also includes measures to protect the patient from physical injury during the attack. For the airway management, there are observation and therapeutic. For the observation one is monitoring breathing patterns, including frequency, depth, and effort breath. The rationale to observe regular breathing pattern or any observed problem with breathing patterns like dyspnea, prolonged expiration, and periods of apnea. Next is monitor for additional breath sounds, such as gargling, wheezing, and dry rhonchi. The rationale to reveal the presence of pulmonary congestion or collection of the secretions, fluid, or blood in the airway to determine the need for further intervention. For the therapeutic is to positioning semivolar or volar to maximize lung expansion. Then perform suction for less than 15 seconds is to reduce shortness of breath by airway obstructions. Next, for seizures management, there are observation, therapeutic, and education. The observation one is to monitor the occurrence of recurrent seizures. The rationale to monitor for recurrent seizures. Next, monitor vital signs. The rationale is regular monitoring of vital signs can determine further nursing progress. For the therapeutic, to maintain the airway patency. Then, loosen clothing, especially the neck. The rationale to prevent injury. For the therapeutic one is keep away dangerous objects, especially sharp objects. The rationale to sharp objects can cause injury to the patient during a seizures, accompanied during the seizure period. The rationale monitoring the patient's condition during a seizures. Attach a IVSS necessary. The installation of IVSS as a pathway for administering electrolyte, fluids, and drinks and drugs. For education, to advising the family to avoid putting anything in the patient's mouth during the seizure period. The rationale, the presence of foreign object in the mouth can cause injury to the patient during a seizure.
So this is the epilepsy pathway. The pathway of epilepsy in the image shows the processes that occur in the brain when someone experiences a seizure, which can be caused by various factors. I will explain it simply. First one is etiology or initial causes. There are several risk factors that can trigger seizures, such as infections, encephalitis or meningitis, or trauma at birth, mechanical injuries to the brain, bacterial or viral infections outside the central nervous system, tonsillitis, bronchitis, and then the second is disease process. This infection or injuries can cause changes in the brain, such as accumulations of acetylcholine, a chemical involved in the transmission of nerve signals, or scarring in the brain. This leads to stress on the brain and damages brain tissue. Injuries or changes in the brain affect electrical activity, causing electrical charges to be released abnormally in neurons or nerve cells, resulting in seizures.
And the third, we have clinical manifestation. These abnormal electrical charges lead to various clinical symptoms such as hypersecretion of mucus, which can cause the airway obstruction, and motor muscle seizure that cause respiratory muscle to contract, and hypoventilation or slow breathing, which eventually lead to tissue hypoxia or leak of oxygen in tissues. This can affect blood flow in the brain, intracranial pressure, and the patient's consciousness. And fourth, we have nursing problems. From this process, the nursing problems that arise include ineffective breathing pattern and acid-base disorder due to airway obstruction or respiratory muscle spasm, and cerebral perfusion disturbance due to disrupted blood flow to the brain, wrist injury due to seizure that can lead to accident, sensory perception disturbance that can occur due to the brain damage. And overall, epilepsy is caused by abnormal electrical activity in the brain that triggers seizure, which can arise from infection, injuries, or other factors.
and these seizures affect the respiratory function, blood flow, and the patient consciousness, potentially leading to various nursing problems that need to be addressed.
And this is the reference that we use for our materials. So that's all our presentation today. Thank you so much for watching. Bye bye.